Hello, welcome to another video with Paula Anderson Coaching and Consulting. My name is Paula Anderson and I'm your instructor. And before we get started into the topic, I want to introduce myself and give you a little bit of background about who I am. So I have a bachelor's degree in English, have a bachelor's degree in journalism with emphasis in public relations, and I also have a master's degree in journalism with an emphasis in public relations as well as strategic media. So this video, we're going to talk a little bit more about evaluation management. So I want to give you a few more guidelines that you need to be aware of so that you can be successful on this part of the certification exam. So evaluation management are listed in the front of the manual because they're the most frequently used codes. So anytime you have to have a procedure done, you have to have an office visit first. So you want to make sure that you understand that that's one of the reasons why they're in the front of the manual. Now, what we're going to talk about today, we're going to talk about new versus established patient. We're going to talk about clinical staff, the definition of that, initial versus subsequent, medical decision-making, the SOAP format, review systems, E&M history, categories, modifiers, and then examples, which I'm only going to give you just the modifiers. I'm not going to explain those because there's another video that I have on modifiers. So this is a definition that you want to find. You'll find on page 4 in the 2026 edition. And this is also the AMA's definition. So a new patient has not received any professional services from the physician or other qualified healthcare professional or another physician or other qualified healthcare professional of the exact same specialty and subspecialty who belongs to the same group practicing for the past 3 years. Okay, so that's going to be your definition. Now, an established patient, of course, is someone who has received services, okay, within that 3-year period. But when you're talking about new patient, providers bill under the same tax ID number. So when the claim goes through, if they're under the same tax ID number, then that's why they reject as you not being able to bill it. So that's why you have the specific guidelines as relates to that. Now, clinical staff. So this is the AMA's definition. A clinical staff is a person who works under the supervision of a physician or other qualified healthcare professional and who is allowed by law, regulation, and facility policy to perform or assist in the performance of a specific professional service, but does not individually report the professional service. So when you think about CPT code 99211, which is what we call a nurse visit, you don't, the physician is actually not seeing a patient. And this is actually being billed on the provider's name, although a nurse will be doing some type of service. So an example would be administering vaccines. So this would be the code that would be billed along with the vaccination codes. All right, now let's talk about initial. So this is terminology that you're going to see. So when you're getting ready to read your scenarios, you have to determine, if it's the patient's first time that they're being treated or if it's another visit. All right, so initial, and I'm going to read to you the definition. A patient has not received any professional services from a physician or qualified healthcare professional or another physician or other qualified healthcare professional of the exact same specialty and subspecialty who belong to the same group practice during the inpatient, observation, or nursing facility admission and stay. So you can only be an initial patient one time. So if you go in today, you're considered to be initial. Now, if you stay beyond today, then of course that moves to a subsequent. So let me give you the definition of subsequent. A subsequent service is when the patient has not received professional services from a physician or other qualified healthcare professional or another physician or other qualified healthcare professional of the exact same specialty and subspecialty who belongs to the same group practice during the admission and stay. So again, you have to build the initial first and then you build the subsequent. So let's talk about medical decision making. So medical decision making is one of the criteria now that is used to determine what your level is going to be. So if you turn to your CPT codes, and let's just look at 99202. All right, so you see 99202, and Underneath where the description, it tells you that the patient has had a medically appropriate history and examination, and then it gives you what the medical decision making is. So for 99202, medical decision making is straightforward. So medical decision making by definition, so it establishes a diagnosis, assessing the status of a condition, and selecting a management option. So when you go in to see your provider, once you give them your chief complaint and any symptoms or signs that you're having, then of course they're focusing on the medical decision making. What am I going to do in order to treat this patient to make sure that they are well? All right. So it also focuses on the number and complexity of problems that are addressed in the encounter. So, for instance, if you're being treated for diabetes, you're being treated for hypertension, and if you're on medication, then of course, the medication has to be managed. The medication may counteract with one another. So, you want to make sure that's what physicians are addressing, the complexity of problems that are being addressed. And then if there's any type of data that needs to be analyzed or reviewed, so that's going to be medical records, that's going to be tests or other information that must be obtained, ordered, reviewed, and analyzed for the encounter, and also the risk of complication. So if you don't take your medication, is there going to be a morbidity? Or is there going to be mortality? So those are just, some of the specifics as relates to medical decision making. So if you look under your CPT code 202, it's straightforward. If you look under 99203, it's going to be low level. And then you look under 204, it's going to be moderate. And then at 205, it's going to be high. All right. So for the purpose of taking the exam, you're looking for the medical decision making if it's not based off of time. So time has to be documented in order for the use time. So underneath your code for 202, it tells you time is 15 minutes must be met or exceeded. That means that you have to actually know the time frame that they were being treated based off of the time factor. 203, 30 minutes must be met or exceeded. 204, 45 minutes must be met or exceeded, and 205, 60 minutes must be met or exceeded. So those are going to be the two ways that you determine what your E&M level is going to be. Now, probably in a subsequent video, I will kind of break down some of the categories to give you a little bit more specifics about some of the guidelines and how you would code those. But for the purpose of this video, I'm just kind of going over some of the basic principles. All right, next we're going to talk about the SOAP format. So the SOAP format is the format that physicians use to document. So we have subjective, which is the S, that's going to be the chief complaint in the patient's own words. We have objective, which is examination. That's going to be a review of the body areas and then the organ systems. And then assessment is going to be diagnosis. So that's going to be what's wrong with them, the ICD-10. And then plan is going to be treatment. Are they going to have any kind of tests? Are they going to have any kind of prescriptions? So when you're coding from the actual note. So coding from the actual note is when you actually determine what the level is going to be based off of this documentation format. For the purpose of the certification exam, your scenario is going to be provided for you. So it may not necessarily be in a SOAP format. So you want to make sure that you understand how it's going to be laid out. All right. The next thing that we're going to talk about is review systems. So review systems focuses on what are the areas that the physician is going to take a look at while you are being treated. So you go in for abdominal pain as your chief complaint. And let me give you what the review systems are. Give me just a second. What's on that? Okay, so the review system consists of constitutional symptoms. So that's going to be the fever. That's going to be your blood pressure, your height, and your weight. Eyes, ears, nose, mouth, and throat. cardiovascular, respiratory, gastrointestinal, musculoskeletal, integumentary, neurological, psychiatric, endocrine, hematologic, lymphatic, allergic, and immunologic. So when you think about the review system, if you go in for abdominal pain, of course, they're going to do the constitutional, and then, of course, they're going to do the gastrointestinal. So there may be some other systems that they review, but definitely they're going to do the constitutional. All right, so now I want to give you a little bit of background about evaluation management in terms of how we got here. So prior to 2021, the guidelines were very complicated. All right, we had two sets of guidelines, 95 and 1997. And so physicians had an opportunity to decide which one of those guidelines that they wanted to use in order to select the level N of code. So you had to be consistent. You had to do either 95 or you had to do 97 in terms of how you determine what your level was going to be. But because of all of the administrative burden that physicians complain about as relates to paperwork, they decided that they wanted to reduce this. And so they eliminated the calculation of the history and examination. So you don't have to calculate that with your code. And actually, I tell individuals that are preparing for the exam or preparing to be a medical coder that it is actually it's easier now to determine your N level because you're only looking for the category, the subcategory, the medical decision making, or the time element. So it's much easier for you to determine what the level is going to be. But that was one of the reasons why the changes were made, okay? Because it was a way to reduce administrative burden for physicians. And actually, it has helped medical coders as well because now you don't have to do all of that anymore when you're trying to determine what the code is from a clinical note. All right. And so we talked a little bit about time, but I just want to just kind of recap that time is a factor. And so underneath in your CPT codes, it gives you the time frame that would actually be used to determine what that level should be. Now, I'm going to walk you through how to use your index. So I want you to go to your index. And if you have a 2026 manual, I want you to go to evaluation management. All right, so evaluation management, of course, you have all of the services that you will code in the index. So if you're trying to take the exam, one thing that I do not recommend that you look up all the codes and then determine what your answer should be. That is going to waste all of your time. You need to have some knowledge base established. And in a video, I talk about another video, I talk about learning styles. So you may want to go back and you may want to listen to that video. You have to have a theoretical foundation, but you also got to have a practical foundation. And so when you get ready to coach your exercises, you're trying to determine what the service is based off of the keyword, the main term. So we're going to take a short pause and come back. Okay, we're back. So at this point, you should be at your index, and I'm going to give you some scenarios to look up in terms of just want you to look up the codes, so that you'll know how to look these up. So I want you to look up the code range for now. In order for you to actually code, of course, you're going to have the medical decision making or the time factor. So we're not going to code it. So I want you to look up the codes for office or other outpatient services. They will look up Office of Other Outpatient Services. So once you get your code range, so this is telling you that this is where you will find those codes. And then you have to go back and look those up in the actual numeric portion. So if you look at Office of Other Outpatient Visit, it gives you a breakdown of consultations, established patient, new patient, prolonged services. So we're just going to focus on the new patient and then the established patient. Okay, so that's how you would look that up. Now let's look at hospital inpatient services. So under hospital services, you have a breakdown of admission and discharge. Same day, you have consultation, discharge day management, you have initial, you have prolonged, you have subsequent. All right, so remember what I talked about earlier in the video. Initial means that they've never been seen. This is their first visit. All right, so the code range for that is 99221 through 99223. All right, subsequent means that they've been treated before. So day one, they got the initial visit. If they're a second day, that's going to be subsequent. And that's going to be 99231 through 99233. All right, and then if they are released on that third day, then you're going to do a discharge code. And so you see what your discharge codes are, 99238 to 99239. All right, so let's look up preventive medicine. All right, so preventive medicine, so this is going to be for services that are done on an annual basis. So if you're being seen for the very first time, then of course you're going to be considered a new patient. But if you're coming back every year to get an annual exam, then you need to be an established patient. So your code ranges for that is going to be established. It's going to be 9923, 99391, 99397. And for your new patient, it's going to be 99381 to 99387. So again, what you're doing is you are actually looking up the actual main term to determine what your codes are. Because if you try to look up every single code, that is going to eat up all of your time. So that is not a strategy that you need to use as well. All right, let's do consultations. So I wanted to do consultations by itself. And so you have consultation, inpatient observation, then you have office or other outpatient. So let's look at the office or other outpatient, which is 99242 through 99245. So that's going to be your range. All right. And then the last one is going to be newborn services. So newborn care, it ranges from 99460 to 99465. All right. So that's going to be your code range for that. So, and then I'll just kind of briefly talk about the modifiers, just modifier 24, unrelated in service during the post-op period, 25, significantly separate identifiable in service, and then 32 is mandated service, sorry, and then 57 is decision service. So I do have another video on modifiers, watch that video. So stay tuned for more videos from Paula Anderson, Coaching Consulting. I appreciate you watching this video. Make sure that you like my channel. Make sure that you subscribe to my channel. Make sure that you like this video. And if you have any comments, feel free to make those comments in the comment section. So stay tuned for the next video.